Before the hormone, were you also asked to go for radiation or surgery? Is this an options that you have?
No.
What?
Well, I was diagnosed in Bangkok
Yeah.
2 years ago, in June 2007, and of course it was by a urologist.
Yeah.
And of course the first thing the urologist says is a surgeon is surgery.
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 So were you asked to do surgery?
I was asked to do surgery, either robotic or the one without the Da Vinci thing. They do the Da Vinci thing in.
Yeah.
So I said, oh well, I'll think about that. Have you got anything else?
Yeah.
So he referred me to another doctor who was a radiation oncologist,
Yeah.
and that's in a cancer centre in one of the very big hospitals in Bangkok.
Yeah.
And he suggested high dose brachytherapy,
Yeah.
where they don't implant seeds permanently. They have a as I understand it, a radioactive probe which they stick in the prostate for some time, minutes or whatever, and then it's a very high radiation probe, and they withdraw it, plus external radiation. Now, with that, of course, the first thing I asked him with that was, well, what's the survival on that then?
Yeah.
And he claimed that the protocol he used, which was from Kiel University in Germany, the survival over 8 years was 93%. In other words, 7% die.
Yeah.
But then I said, well, what about the failure with the PSA going up? Your blood test showed that the treatment has failed, basically, because your PSA is going up.
Yeah.
Then what percentage of those patients is the PSA going up?
Yeah.
And apparently, I believe it was something like 23%.
Yeah.
So you can see that about a quarter of them, 25% of patients in 8 years, basically the treatment failed, and 7% they died.
Yeah.
So that was then when on the internet, I was scouring around the internet. I didn't know anything about you then, but I found out about the doctor in Singapore on the hormone therapy, and his survival of his patients with 1% dying in 8 years seemed better, so I went for that anyway.
And it would have been cheaper to do a hormone rather than doing radiation and or surgery.
Well, when I went to, I really.
You didn't go into the
I didn't go into the. I think the surgery would have been, of course, a lot cheaper. I think the radiation would have cost, I think in Bangkok, I think he mentioned in dollars, it would have been about $15,000. $15,000 to do the radiation.